Well, it is time for our weekly Healthy Living segment. Dr. James Hawley of Southeast Texas Medical Associates joining us now. Dr. Hawley, we're looking at today, how do patients actually know if they're getting the good care?
The Commonwealth Fund, which is a not-for-profit educational organization in New York City, in 2007 published a report on transparency and public reporting of quality metrics. And what they suggested that physicians and home health agencies, nursing homes, and other healthcare providers would benefit from publicly reporting their performance on certain quality metrics, and then patients could judge whether or not they were getting quality care on the basis of those. In 2009, SETMA, after using quality metrics for 10 years, decided that we would start doing that. And so we actually post on our website at www.setma.com our quality metrics.
So that is available to the public?
It's available to the public, and if you want to see how I treat diabetes, you can go there under public reporting, look up the diabetes model, and you can look at my name and see over 16 different measure sets for diabetes, how we treat that. We do over 250 quality metrics, and it gives us an opportunity to become really accountable for what we're doing.
Mm-hmm. And you just compile that information between your doctors at SETMA and then allowing people to sort of, I guess, break it down themselves and ask questions?
Exactly. What we do is we track over 250 quality metrics on every patient that we see.
Okay.
We then audit that for populations and see how we're doing as a group by individual providers. We do statistical analysis on that to see not only what the average performance is, but then looking at standard deviations, see how we're dealing with the whole population. Then we publicly report it so that our patients can know how we're doing. We started doing this in 2009 because we developed a medical home, which is we'll be talking about here in a few weeks, in order for patients to get the kind of care they used to get back in the 1940s and 50s, very personalized care, but technologically advanced and using electronics to improve the quality of care they're receiving.
Wow, and do you know if medical groups are actually voluntarily doing this as well?
We're not aware of any other group that's voluntarily doing a quality metric reporting publicly by provider name. There are some places, Minnesota, where it was legislated in 2009, that beginning in 2010 they would track certain quality metrics and they would report them in 2011, but that was done not by individual provider, but by practice. And so we're not aware that it's being done. It's really important, though, because it makes like we talked last week about Framingham, where the patient can know if they make a change, it will make a difference. Public reporting of quality metrics puts providers on notice that people are going to know how they're doing and how they're performing. And we put it out there and show that what it is. Our patient satisfaction surveys are out there as well, which is a little bit, that's not by provider, that's by the whole clinic. But if somebody doesn't like us and they say so, we put it out there because we believe that ultimately our patients are going to benefit, we're going to benefit, healthcare is going to benefit, and that's a win-win.
All of it benefits from the honesty.
Absolutely.
Thank you, Dr. Hawley. We always appreciate this segment. All of this will be on our website as well as the website for SETMA in case you missed any of that or have any questions for Dr. Hawley and the doctors. Thank you
very much.
You're welcome.